Welcome to the Byja radio show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kinba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. And we are back once again for an amazing, thought-provoking episode 26 of Byja Radio. And
Deuce McAllister, 26.
Well, there you go. Byja Radio Show is in the saddle. You are, again, with us. You could have been anywhere in the world, but you're here with us. And by us, I am Dr. Jasper, one of the amazing hosts. I'm going to give myself a little credit, but I'm only amazing because I am sitting next to the amazing, stupendous, magnificent brother from another mother, patient zero, Mr. George Becnel is back with us in the co-host seat. Brother, how are you doing today?
Man, thank you for that amazing introduction, brother. I'm doing well. I can't complain about a thing, good brother.
There you go.
How you doing?
There you go, man. I'm doing all right, brother. I mean, I'm always doing well because that's just how I am. And I am like that because I already know as much as people can say, as much as they can do, I know I'm going to be good. And I think that's a different thing for a lot of people, and it's tough, which informs some of what we're talking about today.
Right.
And you know kind of what we're talking about. You actually brought it up to me and said, I think we should talk about this. And I said to you, I thought we already talked about that in the previous episode. You said, well, we might have, but not like this. You know, we need to talk about this. Yeah. And I said, man, I appreciate you because I didn't even think about it like that. And that's partially because just how my mind goes. And what we're talking about today is mental health. And more importantly, mental health for male patients or male people, gender, whatever you want to call, right? We're not trying to be the newscasters where everything is said in this most eloquent way that everything's perfect. I'm saying that mental health for men is what we're kind of focusing on. Women, if you're listening, we appreciate you. We're not saying don't listen in, but this can be helpful for you to say, look, I got people in my life. I want to make sure I'm doing my due diligence to give them what they need in this capacity. So we want to cover this topic because the news that came out that, you know, really was unfortunate. And, you know, I'm going to turn it over to Patient Zero because he is a diehard LSU fan and diehard, like to the point where, well, first off, let me go back. Die Hard is an understatement. I just want to say he's a walking almanac. If you have no idea what I mean, just ask him random LSU questions. And I don't mean just one sport. I mean like pretty much all of them. So by Die Hard, this guy literally loves, breathes LSU.
Yeah.
When that news came out about this young man and what happened, it was just one of those things where it's been really heartbreaking. So George, do you want to kind of give some context on what we're talking about? And I believe he was from, I think, Thibodeau.
Yeah, he's from Thibodeau. Thibodeau between Donaldsonville and Homer. Yeah. A little closer to Homer.
Yeah. Yep.
So, you know, the young brother, Kyron Lacey, you know, committed suicide on April 12th, right? So just to give a little context, Kyron Lacey was a guy who, he was a standout wide receiver, started his career at UL Lafayette, transferred to LSU, played 3 years for the Tigers, and was a projected first-round pick. This guy was an explosive receiver. He ran great routes. He caught the ball at the highest point. He was one of these guys who was like the total package at wide receiver and was going to be a first-round pick easily, in my opinion, right? After his last year at LSU in December of 2024, he was accused of causing a head-on collision, which resulted in the death of a 78-year-old man by the name of Herman Hall. He was charged with negligent homicide and was facing a hearing 2 days before he actually passed away. Being that he committed suicide, I didn't talk to him. I didn't know him personally. And I didn't talk to anybody who did know him and ask, you know, what was conversations with him like. It would just seem after those events that he was having difficulty dealing with the fact that he got in an accident, someone died as a result of the accident, and he also was facing negligent homicide. I don't know if that's the reason. However, I don't think it's a very difficult assumption to make. But whether that's the case or not, this young man probably felt like he had no options. He had nowhere to go. And that was the actual inspiration for the episode.
And I think you hit a lot of high points that we need to talk about, right? Specifically, when people are going through things, it's often not surprising, right? Like, we know people are going to go through a lot. It's basically life, right? There's ups, there's downs, there's trials, there's tribulations. But I think what we are trying to get at is that a young man not only tragically lost his life, he lost his life when he had so much life ahead of him. And that's something that a lot of people shouldn't want to normalize. I'm not saying anyone's doing that, but I don't want it to be where we're sitting in this seat, this media seat, and I use the word media intentionally, that people are listening to us, hearing what we're saying, internalizing it, using it for hopefully improvement. And we don't want it to be where people are starting to normalize that when someone cuts their life short, that it's just kind of a, well, that's just the way it is. It should never be that. And the issue we're running into is that males, specifically black males, tend to have more episodes of depression, anxiety, and other mental health factors. And they oftentimes don't want to get help because they're taught that it's not something they should have to deal with. It's stuff
Thanks.
that they just potentially have, and they need to man up and all these other terms I've heard. Or, if you do that, you're crazy and things of that nature. So we're going to hopefully try to dive into this a little bit deeper with the hope that we're going to clarify some of this stigma and remove that, and also help people better understand what is going on when it comes to mental health in the country, particularly around the men, and if not specifically black men. So Patient Zero, you set the scene, kind of where the story came from, why we're talking about this today. So I want to start by going over some statistics. I think it always helps to inform why we are doing what we do and why we are talking about things that we talk about. So I put together some statistics about different things mental health related. Can you do me a favor and highlight to the people different things like depression, anxiety, suicide? Can you give us some of the numbers that may be impactful for patients or listeners or people who are out hearing this episode?
Sure. So 8.3% of adults in the United States experienced a major depressive episode in 2021. And that's reported, right? I would even dare to say it's at least 3 to 4 times is that, people experience these type of depressive episodes and just don't report them. In 2021, to put things in context, that was during the height of COVID. So there was probably some more mental health challenges as well. Now, out of that 8.3%, 6.2% were adult males. Young adult males age 18 to 25 had the highest rates. So out of every 10 people that experienced a depressive episode, young males age 18 to 25 was represented 2 of those people. So essentially around 20%, right?
Right.
Anxiety, another mental health challenge for people. 19.1% of U.S. adults had anxiety disorder in the past year. That's almost 20%. That's almost 1 out of every 5 people.
Yep.
Right. And again, that's people who were diagnosed. That's not people who deal with anxiety and don't say anything. So these numbers should be rather alarming to everybody, right? 14.3% of men experienced it compared to 23.4% of women. So again, I don't think more women dealt with anxiety than men. I just think, in general, women are better about getting the help they need than us because of, toxic masculinity or other things of that nature, right? Now, when it comes to suicide, nearly 50,000 people lost their lives to suicide in 2022. 50,000 people in a year. Men accounted for 80% of those deaths. So 4 out of 5 suicide cases were men. That should be alarming. Obviously, 4 out of 5, one person being a woman, that's 4 times higher for men than it is for women. That's a lot. Now listen to this one. Black men aged from 15 to 24, suicide is the 3rd leading cause of death, with nearly a 50% increase in rates from 2013 to 2019. So of all the causes of death, sicknesses, all the different sicknesses, car accidents, work-related accidents, being murdered, all these different ways to die. Suicide is the 3rd leading cause of death among black men. That's alarming.
Yeah.
For black men aged 15 to 24, excuse me.
And I think, again, that's the part that the mental health conversation, of course, may happen. It may happen in a lot of spaces, but it's hard for people to wrap their head around when we're saying that this is something that's very, very prominent. It's not something that you may think is over there, and it's not somehow in your stratosphere, or it's not in your household, it's not in your community, it's not in your church, it's not in your fraternity or sorority. It is present. It's just whether or not people are A, diagnosed and getting treatment, or B, having the actual symptoms and don't know what it is and don't know really what to do or how to actually get help. So if you are listening to this, you're already doing something that a lot of people don't do. You're trying to find some type of solution, but more importantly, we want you to be able to help people know that they need to get help. And if you're one of those people, then we're happy to do that to try to help you so you can then help other people.
Yep.
But if there are 4 out of 5 people who commit suicide, those people are males. And then when we talk about black males, 15 to 24, their 3rd leading cause of death is suicide. That tells you that this isn't something that just kind of happens. This is something that's here and it's not going anywhere, and we have to do a better job of trying to get people into care, to get help before it's too late. And it's not just saying that a person has anxiety. It's not just saying that a person has depression. It's saying that these things have gotten so bad that they feel the only way to get it taken care of is to take their own life. That's a problem. And we don't want that to happen. We want people to do exactly what they should do, which is get into care and get help when they need it most. So we're going to pivot for a second, and we're going to talk about this in a very specific context. So George, I want you to tell the people, based on the conversation we had, if you're talking about these patients, males, whatever you're calling, when we're having that conversation, how many times have you ever been in a space where you say, hey, I'm talking to somebody, they're going through something, and I can tell something's going on, but that person just doesn't really want to talk about it, specifically men, right? I'm asking that question because I feel like more than likely we've all been in situations where someone probably is going through something, and if it's a male, they usually don't feel like they need to talk about it.
Right.
They feel like it's better to just deal with it. Mm-hmm. Would you think it's safe to say that's pretty accurate, or you've been in those situations before? Absolutely,
that's accurate. I think in society, there's an expectation that men have to be strong, and what that does is that discourages vulnerability, and it's a very toxic trait. And I think, in my opinion, that's where toxic masculinity comes from. We're taught that you can't be weak. You're taught that you can't ask for help, and those are societal norms that men deal with. And I think ladies do a better job of knowing when to ask for help, knowing when to go get help, and taking care of themselves. That's why women typically outlive men. That's also why, we just read the stat on the suicides. That's why 4 times the amount of men commit suicide that women do. And I think that's a whole idea that we need to just get away from as men, because, going to see a therapist, talking to your friends, having mental health empowering actions or mental health breaks doesn't make you weak. And I think this is something that we absolutely need to talk about. When you're hanging with your friends and you're having guys' night, instead of just only talking about sports and getting money, you need to talk about what's going on in your mental, making sure you're clear, check on your friends, and have that open dialogue and things of that nature, because it's literally killing us,
I agree. And I think you are going into a few different things that lead to this, right? So you hit the nail on the head that people are having that toxic masculinity. And even if it's not toxic, it's just the misconception that if you are somehow vulnerable, you have a period where your mind is not as strong as it quote unquote should be, that you're somehow weaker than what other people are. That's not true. That's like if a person somehow says, if you have diabetes, you're somehow not as strong as somebody who doesn't. I mean, that doesn't really correlate. If you're around people who act, talk, and think like that, you need to be around other people. That's the first thing. Because the people who are promoting that ideology and telling you those types of things are the ones that are going to cause you to have worse mental health than you should, or mental health that worsens. And that's not what it should be. It should be that you want people around you that are going to support you, that are going to lift you up, and that are going to literally be around when things get bad to make sure you don't have to go through it by yourself. So the man up idea, the idea that men don't cry, the idea that men don't go through stuff, the men don't have vulnerability, they don't go through losses, that's BS. And black males particularly have to deal with that because they oftentimes have to walk into rooms and have their guard up at all times. And by them having their guard up at all times, they can't let it down even for a second. And when you are taught and raised and brought up in a world that you have to do that, you don't know when to turn it off. You're home around quote unquote loved ones, but you don't know when to turn it off. Yep. You're around friends and you don't know when to turn it off. So at that point, you never let it out. It just eats you alive and consumes you, and we don't want to do that. That's one of the main things, if not the biggest thing.
And something else I need to touch on, it's not an outline, but when it comes to the black community, black people tend to be more spiritual for the most part. And what'll happen is when there's a mental health challenge or a mental health issue, it's common for somebody to say, well, there's nothing wrong with you. You just pray it away or things of that nature, or you just go to the church. And look, I'm not telling anybody not to go to church. I'm not telling anybody not to have a relationship with God, because God knows I do, right? But what I'm saying is faith without works is dead. So
wait, go back, say it again.
Faith without works is dead, right? So if you break your leg, you're not gonna look at it and be like, Lord, heal my leg, and just sit there. You go say a prayer. You go to the doctor. You go pray for healing hands. You go pray for the Lord to move the doctor's hands in a way to take care of you. That's what you go do.
Correct.
It's no different when it comes to mental health. You need to say your prayers. You need to see your therapist, your psychiatrist, whatever route you take, and you need to pray for that person to help guide you, because faith without works is dead. So I just want to debunk that myth, because a lot of us will say things like, "Oh no, baby, there's nothing wrong with you. You don't need no therapist. You don't need no psychiatrist." And that's actually a very crippling idea. So I just had to put that out there.
And I think this is the part that I think hits home. If you tell someone that and they listen to you and then something bad happens,
that's on you.
But no, because of course the people who are oftentimes saying that don't actually take responsibility, because, oh, well, that was God's will. And it's like, I just don't get it. So it just literally is you talking out both sides of your mouth.
Facts.
Right?
Yep.
And if you're doing that, it makes no sense. You can't have it both ways. You have to be able to say, if you're going to sit here and tell me that the person didn't need something and then something bad happens and you're the one who told them not to go and get the help, you have to take the responsibility that you possibly led to that. So why not do the opposite and say, what do you need that will allow you to hopefully feel better? What can I do to help you get better or get the help you need, rather than telling them what they need and it's not helpful? As much as you think that's helpful, it oftentimes can be harmful. And no one's doing it on purpose. We don't think people are saying things directly to others and trying to tear them down. Some people might. And if that's the case, that's a whole different story. But the people who are not realizing, if you say, well, what can I do or what could I have done to make things better? You got to look in the mirror and say, what am I saying that is allowing people to feel like they can't talk to me? What am I doing that makes people feel like they can't open up and share what they're going through with me? Because believe it or not, that's something that happens to me on a regular basis. And it's not because in my mind I'm somehow magically better than everybody else. It's because I've been trained to listen and hear people when they have stuff going on and say, you know what, this sounds to me like something relevant to depression, relevant to anxiety, relevant to PTSD. We need to consider treatment for this in some specific way. That training is not because I'm somehow any different than other people. You can be trained in that too if you want to, but if you cannot or you don't want to, how about you just try to be a better listener? Because one of the other things we run into is having people who can deliver care to certain cultures in a way where the people feel comfortable. The big way or the phrase to put that together is called culturally competent care. If you are feeling like you can't talk to certain people of a certain demographic, that's okay. Maybe you need to find someone who can. So if you're an older person and you can't talk to the young teenage male because they just don't get it, you're not getting through, you don't have to keep hammering them over the head until they get it. Maybe find someone who they will listen to, or they can relate to, or they can open up to. It may not be you as the great grandparent or older parent where you're wondering why they don't listen. You may have to find someone like a patient zero, or someone who's a mentor, or someone who's at a closer demographic that they're more comfortable talking to. There's nothing wrong with that. Because if the ultimate thing is them getting better, them not having a horrible mental health outcome, them literally getting to a point where they feel more comfortable talking to you once they've gotten over the initial hump, that's the best thing. It's not about who won and who got it right and who told them what. It's about making sure the person feels comfortable, feels safe, and can feel like they are able to open up to you and be completely authentic and completely transparent. And I think one more thing that's extremely important, a lot of men are taught to think that they have to be the strong one in their family.
Facts.
They can't somehow, again, be vulnerable and tell people that I'm going through it and I need help. They have to support everybody, because if the man is in the household boohoo crying because he's stressed out about finances, he's stressed out about things going on with relationships, and God forbid he tells somebody that, all of a sudden he's supposed to, again, be the strong one and he can't do anything opposite. That's where the problem lies. Yeah. I have male patients who come into my office that literally will talk to me and tell me that they want to take more fill in the blank instead of getting mental health care. And I'm going to tell you what is the main thing you think most of these men are talking that they need more of. And I'll give you a hint. It starts with a T and rhymes with testosterone.
Oh, my God. Yeah. Yeah. Testosterone. Yeah, absolutely.
Because God forbid, the reason why you don't feel strong and man enough is because you have anxiety. Oh, I can't have anxiety. I just need more testosterone. Like, okay.
But also.
Well, no, hold on. Let me give you one more. I'm not sleeping. Well, I mean, clearly I'm not sleeping because my testosterone, it ain't got nothing to do with those bills that's piling up and that relationship that's hurting you and you're frustrated. That's not why. It's got to be your testosterone's low.
So since you mentioned testosterone, won't you tell the people what happens when you start adding testosterone and you start taking testosterone?
Mm-hmm. Yeah, it can make you more hypermasculine. It can increase different things in your blood pressure. Some people actually can increase malignancy, but that's the thing where it can also worsen mental health if you're taking too much of it.
Right.
It's now making the things that are potentially causing your problem worse. And I have that happen where I'm telling people, well, yeah, your testosterone actually may be a little low. I'm not saying you don't need testosterone, but once we get the number normal and you're still not feeling well, maybe it's not the testosterone. And people will look at me and they're literally my patient, and I'm having a hard time convincing them that they need to talk to someone.
Yep.
They need to find the right therapist. They need to find the right person who can help with medications if we're not able to do that. And even they are difficult, but they're in care. Imagine the people who are outside of the office that have nobody to talk to. Nobody even bringing up that they may have anxiety or depression or PTSD or some type of undiagnosed trauma. Those are people who we're trying to get you, the listener, to hear. These are the men that we're saying you have to hopefully do a better job of helping them see, look, I may not know the answer, but I know something's not right. Maybe we need to find someone you can talk to, like a Dr. Jasper who you can relate to, or a doctor fill in the blank, or a therapist, or a coach, or a mentor, or someone you feel like you can go to, talk to, be open, be authentic with, so we can at least get you in the right space.
So my question is, long term, back on this testosterone, and I just want to get this point out there. I know this is not necessarily mental health, but this is one of the dominoes where if you deal with it the wrong way, you can hurt yourself. If you take too much testosterone, won't that make your body reliant on taking testosterone, and your body won't make testosterone? Is that correct?
Well, not exactly. If you take too much, yes, you can end up becoming reliant on it, maybe not so much dependent. It's not to the point where it's going to cause you an issue where you won't make enough in the future. The issue, I think, is like anything, everything comes in range, right? You have to have just enough and not too much. If you got too much, you can overtreat. If you don't have enough, you can undertreat. So what happens with people is they start to rely on testosterone to make them feel better rather than deal with the emotions and the feelings that are causing them to feel negative. So you're using something to, for lack of a better term, self-medicate.
Yep.
It's no different than alcohol. It's no different than illicit substances or recreational drugs. It's no different than bad relationships. You feel bad about A, so you go to B to feel better rather than dealing with A. Mm-hmm. I've had people who've had really severe trauma, people in my own family that have severe trauma, and they don't want to talk about it because it's easier to do something else. It's easier to talk about something else. It's easier to go and do other things and take your mind and focus on that than to deal what is causing your problem. And you're wondering why relationships are so hard for you. You're wondering why it's so difficult to get into the space you need to get the job you want, to get the raise you want, to get to where your health is better, to get to where you're losing weight. You're wondering why all that's not going right, and nothing in your mind is telling you, maybe it's me and I need to work through this so I can get better. Because, and this is the part that I hope people will hear, and if people hear it in my voice, hopefully they do. I take it very seriously that you will say, if I do this and I get better, what if this is the thing that's holding me back for the last 10, 15, 20, 30 years? What if?
Right.
What if the reason why I haven't been able to get to that pinnacle that I'm trying to get to is because my mental health is literally holding me back? What if? And God forbid that's the case. If I do this and I get better, all of a sudden the door's open. I'm better. My relationships are better. I got a better relationship with my kids. I got a better relationship with my spouse. I got a better relationship on my job. All of a sudden, I like going to work. I'm able to get work done. I'm not over here hating everything and hating myself. So now everything else is just expendable. That's why this is a problem. When you don't love yourself and love what you see in the mirror, you can't love anybody else. You can't get better in all these other areas if you are not taking care of self. However, for some reason, people think mental health is just going to happen. You're going to better your mental health by just existing. That's not how this works. That's like me saying for you to run this marathon, it's just going to happen. You're just going to wake up and you're going to be able to take on these 26, 27 miles.
Yep. Nope.
Easy. That's not how it works. Because
Nope.
your mind, your body goes through things, and you need to sometimes have help to heal. And sometimes that's medicine, sometimes that's therapy, sometimes it's both. But in order to do that, you have to start by saying, number one, I need help. Number two, I need to know where to go and get help. And I'm okay telling people that. And you, as a support around those people who are going through it, you have to be willing to say, I don't have all the answers, but I am going to be here and find them with this person rather than hinder them or be a roadblock or be an obstacle. And I would hate that anybody who's in that mindset of I'm about to hurt myself, they feel so bad that they don't have anybody they can talk to. And that's what it comes down to. A person who's getting into these spaces is so bad in their mind that no one around me will listen. No one is of a certain level that I feel I can talk to them. That should say something to you if people around you feel that bad, that they can't even call you and open up. What kind of person are you that is creating that environment that makes people feel like that?
Yep.
I would hate that ever happens around me. And again, that's why I take it so seriously. It's not just about people saying you ain't crazy and this, that. This is life or death. Mm-hmm. And when people are taking their lives in their 18, 19-year-old, a 19-year-old, that's easily 90 years of life left. 90. I don't mean 9 months. I mean 90 years. And 90 years gone because they felt so bad because people around them didn't say, you know what, I need to take this person somewhere. And hopefully they'll feel comfortable talking, or I'm going to do everything I can to make sure they don't ever feel by themselves. And again, if it happens, I'm not saying that. If you know in your spirit you did everything you could, then so be it. But a lot of people don't really want to have this really tough conversation because they know, yeah, I'm not really that cool with doing all this stuff because you know what? That's just not me. Okay, cool. That's not you. Well, why are you now being a hindrance to the person who's going through it? Because
Facts.
You need to man up.
Facts.
You need to go ahead and do this. It's BS.
So it's so many things that you just said that I feel like we need to unpack. Number one, when you like treat and you don't treat the problem and you
Treat the symptom.
and you treat the symptom, you can also not only do you not fix the problem, but you could create other problems for yourself.
And magnify the original problem.
Yep. Number two, think about who you were at 19 years old. Think about the man you are now and how much you've developed and how much you've changed in reasoning, because I advise some 19, 20, 21 year olds and look, man, I love them to death, but their risk assessment and some of their reasoning is just not there. And you don't expect it to be because they're 19, 20, 21 years old. And sometimes you have to be patient with these people.
Yes.
And you have to understand that you were once 19.
Yeah.
And you once didn't have the understanding that you have now in your early 40s.
Yes.
You know what I mean? And to your point, you have to create an environment or be at least an open-minded person for the younger people that you care about, because they have to be comfortable to come to you or to at least be themselves.
Correct.
Around you. And you don't want to add to the problem.
And I think that's a word for a lot of people. And like I said, this is not overly clinical. We're not going into how to diagnose and how to treat. That's a different conversation for a different day. And more importantly, it's a conversation to be had by the right people, medical professionals.
Facts.
What this is hopefully a referendum on you being a person who hopefully, one, hears this. And if you're going through it, you say, you know what, they're right. If I want to get better, I have to really and truthfully look in the mirror and hopefully be comfortable enough to open up and find the people you can talk to and get help. And if you don't know where that is, feel free to give us a call. I'm happy to point you in the right direction if it's not something I can do. There are phone numbers of people you can call to get that help. But altogether, the goal for us is to say, if that is you and you're hearing this message through the lens of I need help, then let's try to find a way to get help and not feel like you got to do it by yourself, because you're not meant to be in this life by yourself. No one comes into the world by themselves. And even if you feel like you are by yourself, there are people around who want to help you. I guarantee, I know I'm one of them, and patient zero, I know he's one of them.
Yep.
I think the other part is if you are not the person dealing with mental health issues, which I would say a lot of you may need to really reassess that too, because a lot of you don't think you are, but you got a lot of it. But let's just say it's not you, Are you the type of person that is a person of help and support where other people feel like they can come to you and you're not going to rip them apart and tear them down for being vulnerable, for having trouble, for having mistakes and missteps, and making things go so badly for them that they feel even worse about themselves that they want to do everything but live? I don't think that makes anything sensible. And if that's the case, you need to reassess yourself. And you need to consider removing yourself from other people who are in those spaces because you're not helping them, and that's not actually helping anyone. And if that's the case, we are hopefully getting people to say, you know what, this is a tough conversation. It's not all roses. It's not always perfect, but it's necessary because we need to do better. And more importantly, patient zero hit on it earlier. Men are oftentimes living less healthy lives than their female counterparts. And mental health is included in that. It's not just they're dying from heart attacks and strokes and all this. It's because their minds are not that healthy. And if their minds are not healthy and they have to somehow be so masculine that they can't tell you that I'm sad, I'm frustrated, I'm upset, I'm going through it, I'm anxious, I'm going through trauma, I've been traumatized, and you don't have enough sense to say, let me shut up and listen. Let me say, I'm going to do what I can to make sure they don't ever have to walk by themselves. And if you aren't able to do that, and then you're sitting around and saying, well, I understand why everybody in my family, they're dropping like flies on the male side in their 50s, 60s, and 70s. You may be a part of that because you're not able to create an environment to change that narrative.
Yeah.
I've had conversations with family members and patients and friends, and I'm constantly saying, how are you really doing?
Yep.
Not what's going on, and we talk about BS.
And
right?
Look, let's be specific. You know, yes, mental health issues can lead to suicide. But lingering mental health issues can contribute to death in other ways.
Correct.
You know, like anxiety that's been lingering, you know, depression that's been lingering. You don't think that can help with heart attacks or help lead to heart attacks and
take time off your life
and things of that nature? Yeah. Like it's literally all connected. Like it's not a game.
Yeah,
like it's not something cute that we talk about. It's not something in style that we're saying, hey, it's cool to go to therapy. Like this is a necessity for your life. And if you don't think your mental health contributes to your physical health, you're sadly mistaken, and you need to have a conversation with a professional sooner than later.
Absolutely. And the part that I'll go back to one last quick time is that we're sitting here saying that if men are dropping like flies compared to their female counterparts, and you all are sitting here hearing us say that, and you're not saying, well, what am I doing if my family members, the men, are often dying before the women, decades, if not multiple decades before their female counterparts? What can I do to change that? I think one of the first things to do is say, are they mentally where they need to be? Are they really happy? Or are they just kind of going through the motions? Is it to the point where that stress is so deep down and buried they can't even see it? And are we doing enough to support them in a way where they can live longer, healthier, happier lives? If you don't know that answer, then the first thing is to try to figure it out. And from there, getting them into healthcare is one thing. Not just physical health, but mental health. If they go to the doctor and they come home and the doctor says, yeah, this person may have anxiety, depression, or whatever, and you automatically dismiss it and say, I don't want you going back there, blah, blah, blah. That's one of the issues. I've had literally patients come, bring their female counterpart, whether it's their wives or girlfriends, and I start talking about the depression and the anxiety the male has, and they disappear because they came to one appointment with the wrong person. And it's not just because it's a female person, it's because it's the wrong person that's literally telling them nothing's wrong with you.
Yep.
And that's where the problem lies. Again, I'm not saying you have to agree with me. I'm not saying you have to literally and truthfully think that my word is the gospel. But if you have these issues and they're not getting better, and you're having this difficulty with untreated anxiety, depression, PTSD, anything else, before it leads to a negative outcome, why not just try to get help? That's all. That's all I'm saying. So I'm sure we've talked about this ad nauseum. I think we've talked about it to a point where people will know that it's not something that's going to go away unless we do different things. One of the different things, and I'll make it full circle, is getting into care and hopefully having time to talk to somebody when you're going through it. With us at our clinic, in the direct primary care space and direct primary care doctors across the country, you have more time to talk about things like this. More time to talk about mental health, counseling, depression, medications, what sleep will lead to if it's adequate versus inadequate. Those things help people live longer. So getting people into care is one thing, but getting them into the right type of care is another thing. And direct primary care, I believe, is one of those things. Patient Zero, I think, is a testament to this. I think he's been with us long enough to say that he could potentially advocate for others to experience this, whether it comes to mental health, physical health, or any other type of health, financial health, things like that. And if that is something that I know people around us are doing and experiencing, I think we're doing a good job. Hopefully more people hear this, more people will listen, and we'll hopefully get more people into care. So Patient Zero, I think we can close out. Anything else, closing thoughts that you'd like to share? If not, well, how about you let the people know where they can find you?
So my closing thoughts, just to echo a lot of the things that you said. Even if you have access to therapists, even if you feel like nothing is wrong, talk to somebody, because you never know what underlying issues that you may have that might need to be worked out. 2, always have your strong support system. You need to have people that encourages you to be your best self, no matter what that looks like. So you need a support system. And if you feel a way, say something. Don't keep it bottled up in you. Have a good support system. The people can find me at on X at George_Becnel, Becnel Media on Instagram, and also George Becnel II on LinkedIn.
All right, my closing thoughts. You have to understand that self-care, self-checks regularly are important. And if you understand that, making time for rest, for happy moments, and doing things that are going to bring you into a positive space will literally lengthen your life. If you are constantly in go mode, you're not resting, you're always out and about, you're always doing a bunch of stuff, even though you think that's somehow keeping you happy, all it's doing is just basically wearing you out. People literally wants to work all the time, not sleep. Go out all the time and not have mindfulness. Doing things that are potentially helping them feel better in the moment, but they're not fixing the problem, whether it's drinking, partying, doing all these things that we know to be quote unquote fun, but not healthy. We're trying to tell you that's not the way to live the longest, healthiest, happiest life. To get better, you have to sometimes do something different. And sometimes you got to go through discomfort to get to a space of feeling more comfortable.
Yep.
And if you can do that in healthcare, in a space, in a clinic, in a healthcare setting that allows you to be that raw, authentic, imperfect person, good. The rest is going to work out as long as you're willing to take that journey. And we have plenty of people around that can take the journey with you. More importantly, if you know anybody out there who feels like they are potentially going through something and feeling like suicide is an option, try to get them into care. If you yourself are thinking about suicide and needing help, there is a suicide hotline and the number is 988. 988. It's simple. 988. You dial that. You get somebody on the phone 24 hours a day that can help you if you're going through it. And my hope is that you, if you're listening to this, will share that information and be competent and comfortable telling people it's okay not to be okay. With that, you can find us at www.byja.org. That's our website for Byja Clinic. You can also find us at www.byjaca.org for Byja Charitable Alliance. That's our nonprofit arm to help give care to those in need. You also can find us on social media, Instagram and Facebook at Byja Clinic, all one word, and also on LinkedIn, Byja Clinic. So with that, we are going to close out episode 26. A little bit of a heavy episode, but it's a much needed episode. But if you listen this long, we appreciate you. Like, subscribe, share, and come back to see us at the next episode of the Byja Radio Show.